Evening and welcome everybody. My name is Mrudula Joshi. I'm a counseling psychologist and I'm associated with Jyeshtha Care. Uh, today's today's topic it is about taking care of your eyes, especially during the times when we are exposed extremely to the screen and we are using or probably abusing the screen time. Today's guest, Dr. Neha Divre, has completed her MBBS followed by her MS and DNB in ophthalmology. She went to her fellowship in Sankara Eye Hospital, where she had the opportunity to perform over 2,000 cataract surgery at many charitable centers across India. She enjoys writing, and that skill has helped her publish papers in journals and present at national and international conferences. She is a member of national, state, and regional ophthalmic societies. She is a consultant and surgeon based in Navi Mumbai at MGM Hospital Vashi and Reliance Hospital at Koperkereme. Apart from being a surgeon, her passions include art, language, and mental health. Her interests led to the creation of Inner Calling, a venture which aims at awareness and easy availability of mental health resources. She writes and creates artwork for the same. Over to you, Dr. Neha, for today.
Hello, namaste everybody, and thank you so much, Mrudula, for the kind words of introduction. I can see a lot of people here whom I had sent the link to. Thank you all so much for joining in. I really hope that this talk helps you. And without further ado, I think if Mrudula and Srinivas, you're okay, should we start?
Yes, I think we can start.
Okay, great. Give me 1 minute to start sharing my screen. Okay, slides audible and visible, everything okay? Okay, so hello and welcome everybody. What you can see in front of you is a picture of my own grandmother, and I think she's on the session too. I think it's the best way to start a session for senior citizens. Now, all of us have been, in the pandemic for a year and a half, and we've all struggled with it in our own way. But the one thing that has brought us all together, I think, is the fact that we are all now able to access so many devices. We have easy access to the internet, video calling, and all of that. We can so easily connect with each other. But one of the things that I see all my patients facing these days, the primary trouble is that we are all, we have eye strain because of using these screens. Okay. Um, Okay, I forgot to tell you that I will also be speaking in Hindi and Marathi. I'll switch between languages. Okay, so primarily सबकी तकलीफ ये है कि हम स्क्रीन की तरफ देखते हैं और उस वजह से हमको आई स्ट्रेन होता है. ये आई स्ट्रेन क्या होता है, इसको हम किस तरह से अवॉइड कर सकते हैं और इसके लिए हम और क्या कर सकते हैं. और आई स्ट्रेन के अलावा सीनियर सिटीजन्स जो लोग 40, 50, 60s, 60s एंड 70s के बियॉन्ड है, ये सारे लोग अपनी आईज को ठीक रखने के लिए क्या कर सकते हैं बारे में मैं जानकारी दूंगी. ओके, सो लेट्स स्टार्ट. कुछ सवाल पूछ रही हूँ, अगर आप चैट बॉक्स में टाइप कर सकते हैं तो प्लीज डू दैट. उससे हम ये जान सकेंगे कि आपको कैसे लगता है और आप टाइम टीवी पे या कंप्यूटर्स पे स्पेंड करते हैं. ठीक है. सो द फर्स्ट क्वेश्चन, हाउ मच टाइम डू यू स्पेंड ऑन योर फोन और योर कंप्यूटर एवरी डे अप्रोक्सीमेटली? If you can type it in the chat box, nothing like it. Okay, 10 to 12 hours, 2 hours. That's very good. Okay, how much time do you spend watching TV? This can be TV or Netflix, whatever it is, जो भी है. Okay, so I think 6 hours. All right. How much time do you spend on a second screen? Okay, so second screen जो लोग नहीं जानते हैं उनके लिए ऐसे बहुत सारे सीनियर सिटीजन्स हैं जो अभी भी काम करते हैं, कंसल्टेंसी करते हैं, जॉब खत्म होने के बाद कुछ और करते हैं, या कभी कभी दो चीजों को एक साथ देखते हैं. इसका मतलब ये है कि सामने टीवी चल रहा है और आप साइड में स्टॉक मार्केट भी चेक कर रहे हैं, या सामने टीवी चल रहा है और साथ साथ आप कुछ और भी देख रहे हैं. ओके, दैट्स द सेकेंड स्क्रीन. So usually I think almost everybody spends at least 2 to 3 hours like this with two screens. Next question. If you are an older citizen, do your eyes water a lot with age or water a little bit? Is it abnormal? जैसे हमेशा नहीं होता था पहले. Okay, no takers for that question. All right, no watering. Okay, great. Next is your vision blurred? Has at any point you feel कि मुझे साफ नहीं दिखाई दे रहा है, थोड़ा धुंधला दिखाई देता है, अंधुक दिसतं, something like that. Okay, if your vision is blurred, okay, great. And the next question is, do you find it difficult to drive? Sometimes आपको लगता है कि मैं ड्राइव कर रहा हूँ लेकिन साइड से कोई कट मार के गया, पता नहीं चला, या एकदम साइड में कोई कार थी और पता नहीं चला. अगर ऐसे होता है तो ओके, ऑल राइट. So we'll be addressing these questions later. And how many of you have diabetes or hypertension? मतलब बीपी और शुगर की बीमारी. Okay, the average Indian adult. Now when I say average, I mean कोई भी बचपन से लेके ओल्ड कोई भी एटलीस्ट 3 घंटे अपने फोन का टीवी देखने के लिए, जो इंडियन आइडल देखते हैं, डांस इंडिया डांस देखते हैं, देखते कुछ में एट 2.5 घंटे 5 hours हम स्पेंड करते हैं. ऑलमोस्ट 50% हम लोगों में से, मतलब 50% ज्यादा हम उससे बात. ओके, जब मैं आप लोगों से बात कर रही थी इन द बिगिनिंग, तब मुझे कोई मैसेज आ रहा था हॉस्पिटल में और मैं वो भी चेक कर रही थी, और ये इतने कैजुअली हो जाता है दैट वी डोंट इवन रियलाइज कि हम ऐसा कर रहे हैं, राइट. ओके, द नेक्स्ट फैक्ट, जैसे हमारी उम्र बढ़ती है वैसे कभी कभी आंखों से पानी आना और ये सब प्रॉब्लम्स थोड़े ज्यादा बढ़ जाते हैं. काफी पेशेंट्स इस वजह से मेरे पास आते हैं, एंड व्हेन दैट हैपेंस the skin of your face, it kind of becomes a little loose. Skin of your hands will also become loose, of your neck will also become loose. Same way, the elasticity of your skin, जो skin otherwise tight होती है, वो थोड़ी सी गलने लग जाती है, थोड़ी लूज हो जाती है. तो नॉर्मली जो वो पकड़ के रखती है आपके आंसू आंखों के अंदर, वो नहीं कर पाती है. एंड दिस इज बिकॉज ऑफ एज रिलेटेड स्किन चेंजेस. इसकी वजह से काफी सीनियर सिटीजन्स को वाटरिंग की प्रॉब्लम होती है. ठीक है. द नेक्स्ट इज कैटरैक्ट और ग्लोकोमा. ये दो अगेन बहुत कॉमन प्रॉब्लम्स होते हैं जो सीनियर सिटीजन्स एनकाउंटर करते हैं. कैटरैक्ट, इसके बारे में मैं और बात करूंगी, और इन दोनों डिजीजेस के बारे में सवाल मैंने आपको पहले पूछे हैं. सो इफ यू फील दैट योर विजन इज ब्लर्ड or that you're not seeing peripheral things in your peripheral vision clearly, it could be because something of this sort is happening. Okay, the next is diabetes and hypertension, मतलब शुगर और बीपी. ठीक है. अब ये मैंने क्यों पूछा आपसे, क्योंकि इन बीमारियों में जो ब्लड वेसल्स होती हैं, मराठी में बोलना है तो रक्तवाहिनियां, ये जो छोटी छोटी ब्लड वेसल्स होती हैं ये अफेक्ट होती हैं, एंड बिकॉज ऑफ दिस you may have some changes in your eyes. Okay, which is why I asked you these questions, and we'll address them as we go further. Okay, so The first thing, digital eye strain. Okay, it's a digital world. Everybody is on the computer. भले वो छोटा 8 महीने का बच्चा क्यों ना हो, जो अपने ग्रैंड पेरेंट्स के साथ वीडियो कॉल कर रहा है, ग्रैंड पेरेंट्स भी उसको देखना चाह रहे हैं, सब अभी किसी ना किसी रीजन की वजह से कंप्यूटर पे बैठ रहे हैं. ये सब होने की वजह से वी आर ऑलवेज ऑन सम डिवाइस और द अदर, एंड बिकॉज ऑफ कोविड this dependency increased. Now, how can we protect our eyes when all of this is happening? Okay, so screens के साथ हमारा एक love hate relationship है. हमें उनकी जरूरत भी है, लेकिन कुछ हद तक वो हमें harm भी करते हैं. Okay, what does excessive screen time do? One, it strains your eyes. When you feel कि आंख रब करके थोड़ा ठीक लगता है, या मैं आंख बंद करके बैठता हूं तो थोड़ा ठीक लगता है, that means that you have strained eyes. The second thing that it can do, it causes your vision to be blurred, धुंधला दिखना. The third thing, it gives you a headache. पूरा दिन अगर आप किसी भी स्क्रीन पे बैठेंगे, चाहे वो लैपटॉप हो या आपका फोन हो, आप शाम को इस तरह उठेंगे. Okay, you will just feel that a little bit of headache is happening. That is another problem that is caused by screen time. The next one, and the most common, is dry eyes. It means that normally your tear film, which coats your eye evenly, is no longer doing its job. Okay, that's dry eyes. The next thing is neck and back pain. Because हम हमेशा तो ऐसे टेबल और चेयर पे नहीं बैठते हैं, काफी बार तो हम लेटे लेटे मोबाइल देखते हैं, कभी कभी तो हम ऐसे ही बेड पे लैपटॉप रख के नीचे देख के बात करते हैं, right? That causes all these back and neck issues. The next is obesity. Obviously, if you're putting on weight with age and you're not moving around because you're using your screen more. Last is poor sleep, and after that is impaired cognition. Impaired cognition meaning जो हम समझ रहे हैं, जो देख रहे हैं, उसको हम पूरी तरह से absorb नहीं करते हैं, समझते नहीं हैं, right? Okay, so at some point in your life, if you use computers, one of these problems may be happening to you. Okay, now this especially includes all these professions that use computers a lot, like IP, like IT and accounting, banking, people in the front office, so many others. In fact, now even we as doctors, we enter so many of our findings into our laptops. So we also face these problems. Even the retired people who want to pursue their interests online, I see a lot of people um, who are now a part of social groups online, who share music online, who watch something together online. So all of us are basically exposed to the screen and have these problems. Now, what you can see, this rainbow kind of thing in front of you, is just a spectrum. And of these, the blue light is what basically affects us the most when we use our devices. That's why these devices are called blue light emitting devices. What it does is that it causes a lot of scatter, it reduces contrast, it causes eye strain, and it keeps you awake. Which is why if you go to your eye doctor, especially if you come to me, you will always be told कि सोने से 1.5-2 घंटे पहले आप फोन बाजू में रख दो. Okay, especially those of you who are not able to sleep. This even goes for younger population, especially children who are parents say कि वो रात को 12 बज गए 2 बज गए सोती ही नहीं है बच्ची. That's because if you keep looking at your screen, your interest remains peaked and you will not fall asleep. This is thanks to the blue light. Okay, so blue light. Now, we already discussed what excess screen time does. We'll discuss this a little more in detail and some tips to prevent it. Okay, so I already told you, digital eye strain, it is caused because we use devices. But what in addition to this causes this problem? So one big thing is that we use devices in poor lighting, in the sense that we will sit in a dark room, not bother to get up and switch on the light, and we'll keep using our laptop, which is very bright. The second thing, we sit in a place where there's a lot of glare on screen. Some people will see it एकदम ऐसे करके पास में जाके. Some people will sit very far away. Some people don't sit properly, and some people simply don't have correct the power of glasses. That is uncorrected visual problems, and of course a combination of all of this. Okay, so पहली चीज, what is the right posture? आप सब देख रहे हैं, and I can see you on my screen. Okay, I can see that almost all of you are looking थोड़ा सा down. Okay, so what is the ideal thing? If your now if you observe me or if you observe yourself, if your screen is directly in front of you, this is where I'm looking directly in front of me, my eyes will be the most exposed. Okay, the full listing of your eye is exposed when you're staring straight ahead. But if your screen is a little below your eye level, if you're looking a little below without straining your neck, of course, but if your eyes are below, the exposure level is less. जितनी आंख आपकी एटमॉस्फेयर को एक्सपोज हो रही है वो थोड़ा कम है. अगर नॉर्मल में इतनी है तो इतनी है. और जैसे ही एक्सपोजर कम हो जाता है आपका ड्राइनेस भी कम हो जाता है. ये एक छोटा सा कैरिकेचर है जो मैंने बनाया था पहले, बट यू कैन टेक अ लुक एट इट. सो यू हैव टू सिट अप स्ट्रेट, try not to slouch. Okay, in addition to the fact that it helps with your screen, it also helps give you a good posture and a lot of confidence. Next thing, when you're looking at the screen, please keep your screen a little below your eye level. That is ideal. Make sure that the lighting is comfortable. Outside lighting should not be too bright. It should not even be completely dark. If you're going to use the laptop all the time, make sure there's some comfortable padding below your wrist. Many keyboards these days, सारे keyboards को आजकल एक cushions आता है, वो काफी helpful होता है रखने में. Thighs ideally आपके floor से parallel होने चाहिए. अगर foot rest की जरूरत पड़े तो एक foot rest नीचे हो या कोई छोटा सा स्टूल हो तो स्ट्रेन कम हो जाता है. आपका बैक जो है वो अच्छे से सपोर्टेड होना चाहिए. तो अगर आप ऐसे प्रोफेशन में हैं जिसके लिए यू हैव टू यूज द कंप्यूटर फॉर लॉन्ग आवर्स, all your work is on the laptop, make sure you invest in a good chair that will really help you to reduce the strain on your body. Right? This was about posture. Now, some people will obviously say that, okay, if you have a desktop, it's okay. But what if I have a laptop? One important thing that you can do is that you can elevate your laptop. Even now, I'm talking to you on a laptop, but my laptop is placed on a stack of books. And that really helps to have the laptop at a comfortable level for me. The next thing you can do is have a separate mouse and a separate keyboard. Okay, so that your eye, because I'm working at a height, I don't have to keep moving my hand up. I can still work comfortably and not have any strain, right? And the last, of course, is to take enough breaks. Comfortable screen size, what do I mean by that? I mean that if your laptop is like a small notebook, अगर इतना सा ही है तो जो फॉन्ट आपको उस पे दिख रहा है वो ऑब्वियसली बहुत छोटा होगा, या तो आपको बार बार स्क्रॉल करना पड़ रहा होगा. तो आप एक कंफर्टेबल साइज का लैपटॉप ले लीजिए. 15 इंच का होने की जरूरत नहीं है, बट 12 इंच 13 इंच इज यूजुअली क्वाइट ओके फॉर पीपल, राइट? Okay, and the most important and valuable tip is something called the 20-20-20 rule. Okay, the first 20 means every 20 minutes. Okay, every 20 minutes, look away around 20 feet away. Basically, look outside your window at something far away, or at least try and close your eyes for that much time. And do this for a period of 20 seconds. Just count 20 in your head. Even that will help. Okay? What this does is that it forces your eye to blink, which is something that you avoid when you're staring at a screen, right? So 20, 20, 20. 20 minutes, 20 seconds, 20 feet away. Always remember this. It does wonders for dry eyes. Okay? Right. Now, the next thing I want to talk to you about, like I said, glare. तो ग्लेयर होता क्या है? ग्लेयर मतलब हम कहीं बैठे हैं और हमारी स्क्रीन पे किसी और जगह से एक लाइट आ रहा है और उस लाइट की वजह से आप स्क्रीन को सीधे नहीं देख पा रहे हैं, या देखते हैं तो ऐसे कुछ कुछ पार्ट्स एकदम ब्राइट लगते हैं, कुछ कुछ नहीं लगते हैं। काफी बार आप नोटिस करेंगे कि आप कुछ थोड़ा सा ऐसे या ऐसे करके देख रहे हैं, या स्क्रीन को ऊपर नीचे कर रहे हैं, क्योंकि आप ढंग से देख नहीं पा रहे हैं। इसका मतलब देयर इज सम ग्लेयर ऑन योर स्क्रीन। अगर आप इन दोनों पिक्चर्स को देखेंगे आपके साइड में, ओके, तो आप मुझे बताइए कि इसमें आपको क्या लग रहा है। डू यू फील दैट देयर इज समथिंग रॉन्ग, और डू यू सिट लाइक दिस, लाइक द जेंटलमैन इन द फर्स्ट पिक्चर or the lady in the second picture? If you sit like this, then tell me. Or if you feel that there is something wrong with the way they are sitting, that also you tell me. Okay, interesting. I can see people trying to figure it out. That's very nice. Right, first picture there is glare. Yes, there is glare because you can see it on his screen, right? The second thing that I think is wrong with this picture is that he's sitting opposite a window from which there is a lot of bright light coming. ठीक है, करेक्ट। सो आप अगर देखेंगे, okay, both are wrong. The light should not be directly in front of you, because that way there's a lot of light, plus there's your computer. Your eyes are also under a lot of strain when this kind of a thing happens. The second thing is the light is coming right from behind you. अगर लाइट आपके एकदम पीछे से आ रहा है तो वो लाइट आपके कंप्यूटर स्क्रीन पे गिर रहा है, ओके, और रिफ्लेक्ट होके आपको तकलीफ दे रहा है। तो इन बोथ केसेस आपको ये अवॉइड करना है। ना लाइट आपके एकदम सामने होनी चाहिए, ना एकदम पीछे। या तो इट शुड बी ओवरहेड लाइटिंग, एक कंफर्टेबल लाइट, ओके, या तो आप ये कर सकते हैं कि लाइट, एक सॉफ्ट लाइट आपके साइड से आ रहा है, या अगर आप रात को काम कर रहे हैं तो एक छोटा सा नाइट लाइट या ऐसे कुछ है विच इज समवेयर अराउंड यू, एंड at both times it should not be harsh on your eyes. Okay, if you feel ki you're in a room where you can't avoid it, you have to have natural light, but it's right across from you, try to use a curtain or a drape. This really makes a difference for most people. Okay, it helps you deal with this glare. Yeah, so these are a few things that you should remember. Next thing, now when you are looking at something, this is especially for those people who work in or have interests that require them to maybe take notes. Like my mother right now is, I think she's learning spoken Sanskrit and out of interest. तो वो क्या करती है कि उनका क्लास चालू होता है और साइड बाय साइड वो एक नोटबुक में कुछ जॉट डाउन करती हैं, राइट? अगर ऐसा हो रहा है आपके साथ, या से यू वर्क इन अ फ्रंट ऑफिस, आपके सामने एक नोटबुक है जिसमें आपने नाम लिख के रखे हैं किसी अपॉइंटमेंट्स के, और अभी आप अपॉइंटमेंट्स इसमें एंटर कर रहे हैं, समथिंग लाइक दैट, इट मीन्स दैट यू कीप गोइंग फ्रॉम टू डिफरेंट डिस्टेंसेस। योर कंप्यूटर इज एट एन इंटरमीडिएट डिस्टेंस और आपका नोटबुक इज एट अ नियर डिस्टेंस, सो यू हैव टू कीप गोइंग between the two, right? When that happens, your eyes have to focus differently for both, right? So you may have a problem because of something like this. A book usually has sharper letters, and a computer screen is much more variable, because if you use a different computer every day, if you use a screen or a phone every day and then a laptop every day, all these things can cause a little more difficulty in focusing. Okay, so if you have any incorrected or uncorrected visual problems, then your problem becomes worse, right? Okay, so how can you focus more properly? What do I mean by uncorrected vision problems, right? So what I mean is that एक आपको चश्मे का नंबर है, right? Now चश्मे का नंबर होना is not so simple in the sense that सबको लगता है कि 40 के बाद तो नंबर लगता ही है, उसके लिए तो नजदीक का चश्मा पहनेंगे तो हो जाता है. And now tell me if anyone is guilty of this, okay? People who use glasses of other people in the house. Does that happen sometimes? आपको अपना चश्मा नहीं मिल रहा है, आप लेकिन हस्बैंड का चश्मा है बेड साइड पे, आपने वही लगा लिया थोड़ी देर के लिए या ऐसे कुछ. A lot of people do this, and if you don't, I'm very glad, because that means you're already on the right path. But a lot of people do this, that they use someone else's glasses, or they use very old glasses. कि last, when I ask them कि last time चश्मे का नंबर कब चेक कराया, they say हो गए होंगे 4-5 साल, right? So that's not how we can use glasses, especially as senior citizens. Why? Because when we grow, when we age, there are many changes that are happening in our body, but specifically in our eyes. There is something called a lens. This lens is changing its color. Okay, it's a normal part of aging, बट जब इसका कलर बदलता है तो धीरे धीरे उसमें मोतियाबिंद होना शुरू हो जाता है. और जैसे ये कलर बदलता है, उस लेंस का स्ट्रक्चर बदलता है, उस हिसाब से अपने चश्मे का नंबर भी बदलता है, राइट? और जो नजदीक का नंबर होता है वो हर थोड़े थोड़े सालों में बदलता रहता है. इट्स एन एज रिलेटेड इशू. इट कीप्स चेंजिंग. एट 40 it may be +1, but then it increases slowly. Person at 60 may be wearing a +2.5. So if you don't check for 5 years or so, you may have a changed glass power which you are not using anymore. So what an eye doctor can do is that, one, we will check if your glass power is correct or not. And if it's not correct, or if it is correct, then we'll have to see if there are any other reasons because of which your vision is blurred. ठीक है? So basically हर साल चश्मे का पावर चेक कराना है. Okay. Now a lot of people ask me, what is the right glass to wear? What is the right type of glass? Now, the prescription, okay, first, like I told you, not one size fits all, in the sense that you can't use somebody else's glasses and say that I can't see properly or I can see properly. It needs to be customized for your age. It needs to be customized for your working distance. It needs to be customized according to your job requirements and many other things. So चश्मा एक बहुत इंडिविजुअल चीज है, उसको आपको अपने आप ही चेक कराना है, राइट? 40 के बाद, जैसे मैंने आपको बताया, पावर चेंज होती रहती है, तो हमको और थोड़ा ध्यान देना है. फिर अगर आप मेरे पास आते हैं या किसी भी ऑफ्थाल्मोलॉजिस्ट के पास जाते हैं, वो पहले आपको ये पूछेंगे कि आपका वर्किंग डिस्टेंस यूजुअली क्या होता है, दूर के लिए और नजदीक के लिए कितना नंबर देना है. अगर आप बहुत टाइम कंप्यूटर पे काम कर रहे हैं तो आपको कोई कोटिंग देना है, ब्लू ब्लॉक ग्लासेस देने हैं. अगर इसमें से किसी चीज से आपकी मदद हो पाएगी तो हम वो आपको एडवाइस करेंगे. ओके, सो यू नीड टू फाइंड द राइट टाइप ऑफ ग्लासेस फॉर यू. द नेक्स्ट थिंग, अगर आपका चश्मे का नंबर ठीक है या आपने 6 महीने पहले ही चेक कराया था, पर अभी आपको फिर भी थोड़ी सी तकलीफ हो रही है, टिपिकली पेशंट से की चष्मा लावून पण नीट दिसत नाही, चष्मा लावून पण अस्पष्ट दिसतं, राइट? So this is if you have recently checked your glasses and now you're having some problems. This happens because you may have some other diseases like cataract, like glaucoma, maybe some problem in your retina or any other eye issue, which if a doctor takes a look at, they will be able to help you and tell you what to do about it, right? So that's the most important thing about glasses, a yearly checkup and a checkup with a doctor to make sure that everything else is also okay. फिर ये सबसे कॉमन क्वेश्चन होता है मोस्ट सीनियर सिटीजन्स का. अगर यहाँ पे बहुत सीनियर सिटीजन्स हैं तो आपको पता होगा कि किसी ना किसी का कैटरैक्ट का ऑपरेशन हो चुका है, या आपके फ्रेंड का हो चुका है, आपके पेरेंट्स का हुआ था, समथिंग और द अदर. So what I want to tell you about cataract is that even though cataract happens to everybody at some point in their life, okay, it's like the graying of hair, it's inevitable and it's a sign that you're also aging and gaining wisdom. So cataract हमेशा होता ही है, but cataract के बहुत सारे types होते हैं. अगर आप देखेंगे यहाँ पे तो जो 3 चीजें आपको दिख रही हैं, ये तीनों cataract ही हैं, ठीक है? जो पहला वाला है जो एकदम वाइट दिख रहा है आपको, दैट इज अ मैच्योर कैटरैक्ट. ओके, जो पहले कहते थे कि मोती बिंदु पिघला है या मोतिया पूरा पक गया है, सफेद हो गया है, सफेद मोतिया है. Okay, so that is your white cataract. We generally don't want to wait till this stage to operate on you. We would like to operate a little earlier. Why? Because another common question, डॉक्टर साहब लेजर से ऑपरेशन होगा ना? ये जो लेजर है इसको एज डॉक्टर्स हम फेको या फेको इमल्सिफिकेशन कहते हैं. ठीक है. सो ये जो टेक्निक है, इस टेक्निक में हम एक बहुत ही छोटा सा इंसिजन लेते हैं, जिससे हम आसानी से एक छोटे इंसिजन से हीलिंग भी जल्दी होता है. आंखों के अंदर जाके इस कैटरैक्ट को सॉर्ट ऑफ डिसॉल्व करके वहीं पे सक कर ले और उसकी जगह पे एक आर्टिफिशियल लेंस बिठाएं. ओके, सो दिस इज वन वेरी इंपॉर्टेंट थिंग. तो आप मोतिया सफेद होने तक इंतजार करने की जरूरत नहीं है. ये एक पुराना कॉन्सेप्ट था. आज के जमाने में हम अर्ली कैटरैक्ट में भी ऑपरेट करके आपको क्लियर विजन दे सकते हैं. ओके, ये जो दूसरे दो टाइप के कैटरैक्ट्स हैं, ये इमेच्योर टाइप के कैटरैक्ट्स हैं, पर इनके बारे में और डिटेल आपको बाद में बताऊंगी, if at all you ever need it. Okay, this is just to show you that cataracts are of various types, and having a cataract is not as simple as it usually sounds. The next thing is what I was trying to tell you. So this is your normal lens in the first picture. एक नॉर्मल लेंस क्लियर होता है, उसको आपको थ्रू एंड थ्रू आप देख सकते हैं, लाइट आराम से पास हो जाती है. जो दूसरा है, उसी लेंस में एक थोड़ी सी सफेदी आ गई है, उसका कलर चेंज हो गया है, और उस वजह से अब जो लाइट जा रही है वो कम आपके रेटिना तक पहुंचेगी. ठीक है. सो एन ओपेसिटी इन द नेचुरल लेंस इज कॉल्ड अ कैटरैक्ट. व्हाट आर द साइंस ऑफ अ कैटरैक्ट? या तो आपका विजन जो है, जो आपको दिख रहा है, वो थोड़ा धुंधला दिखेगा. यू विल हैव ब्लर्ड विजन. इट यूजुअली प्रोग्रेसेस स्लाइटली स्लोली. तो चश्मे का नंबर अगेन फ्रीक्वेंटली चेंज होगा, या आपको लगेगा कि थोड़े दिन पहले लिया हुआ चश्मा अब काम नहीं कर रहा है. डिपेंडिंग ऑन द टाइप ऑफ कैटरैक्ट, या तो आपको लगेगा कि अंधेरे में देखने में ज्यादा तकलीफ हो रही है, या कुछ टाइप ऑफ कैटरैक्ट में आपको डे लाइट में या ब्राइट लाइट में देखने में भी ज्यादा तकलीफ हो सकती है. ओके, जस्ट एक एग्जाम्पल देने के लिए, अगर आपको नॉर्मली इस तरह दिख रहा था, okay, if you could normally see that flower very very clearly, in your cataract you may see a more blurred version of the same thing. Okay, this is one of the signs that you may be developing a cataract. The next thing we are going to talk about is how we treat cataract. So as you saw, there was a lens here, एक natural lens था, उसको हटा के this very fine little thing that we've put, it's called an artificial lens or an IOL. Okay, and there are various types of artificial IOLs that we can now place inside the eye. Everything, whether it is budget, whether it is that you want different kind of vision correction, whatever it is, it can be customized to your needs, right? So cataract surgery is in some ways easy, some ways very difficult, but it can be done according to your needs, right? So when should you get tested? Maybe one easy thing that we tell patients is that if you're sitting in your own, say, living room, और जो कोई दूर का ऑब्जेक्ट है, से एक वॉल क्लॉक है या कोई कैलेंडर है, आप एक एक आंख को अगर ऐसे करके देखेंगे तो आपको खुद शायद पता चलेगा. कभी कभी ऐसे होता है कि एक आंख में कैटरैक्ट बढ़ गया है, दूसरे आंख में नहीं है. तो अगर आप दोनों आंखों को कंपेयर करेंगे तो यू विल योरसेल्फ अंडरस्टैंड दैट मे बी I'm not able to see very clearly with one eye. And if that's something that's happening, or you're frequently changing your glasses, come for a checkup and we can help you out, right? Okay, so I can see a question here saying that after cataract operation, I see blurred vision and irritation sometimes. The operation was done 2 years back. Okay, so just to address this question, since we have it here, sometimes after cataract surgery, you may have a little blurred vision a few years later. Sometimes this can happen because of something called a secondary cataract, something that can easily be treated with a small laser procedure. or you may have some other problem happening in your eye. It could be something to do with your retina or your cornea or some other structure in your eye. You should go for a checkup. And if there is anything of this sort that is happening, we can treat you and help you out. Okay. The next disease that I want to talk about, and this is a very important one, more important than cataract, क्योंकि इसके बारे में अवेयरनेस थोड़ा सा कम है. कैटरैक्ट सबको होता है इसलिए सबको पता होता है, लेकिन ग्लोकोमा या कांच बिंदु या काला मोतिया, डिपेंडिंग ऑन वेयर यू स्टे, इसके अलग अलग नाम हैं. बट ग्लोकोमा इज वन डिसीज जो सबको नहीं होती है, इसलिए आप सबको उसके बारे में शायद पता ना हो. ग्लोकोमा 40 के बाद होने के चांसेस थोड़े से बढ़ जाते हैं, बट इसके और भी फैक्टर्स होते हैं, जैसे आपके पेरेंट्स ग्लोकोमा होना, या आपके सिबलिंग्स भाई या बहन को ग्लोकोमा है, या आपको जस्ट एक जेनेटिक डिस्पोजिशन प्रीडिस्पोजिशन है और उस वजह से आपको ग्लोकोमा या कांच बिंदु हो रहा है. इसका मतलब क्या है? ग्लोकोमा का मतलब ये होता है कि अगर आप ये फोटो यहाँ का देख रहे हैं, ठीक है, जो दोनों फोटोज हैं, ये आपके रेटिना की एक फोटो है. इसके अंदर जो जो येलो पार्ट आपको दिख रहा है, ये पार्ट, इसको हम ऑप्टिक डिस्क बोलते हैं. जो नस होती है, ऑप्टिक नर्व, जो आपके आंख से लेके आपके ब्रेन तक सारा इंफॉर्मेशन, सारा विजन पहुंचाती है, उस नर्व का ये आगे का हिस्सा है. दिस इज द फ्रंट, द हेड of the nerve that takes all the information and all the vision from your eye to your brain. So it's a very important structure. There is one in each eye. Okay? इसमें एक छोटा सा cup होता है, right? And when this cup, if you can see, it's very small here. When it becomes big, like this one, that is when we say that you have glaucoma. Okay? Sometimes we need to catch it before it becomes that big. हमको ग्लोकोमा के लिए स्क्रीनिंग इसलिए करनी है क्योंकि जब वो बड़ा हो जाता है तब विजन और ड्रॉप होता है. तो हम अगर इसको अर्ली स्टेज पे पकड़ लेते हैं तो इट्स वेरी यूजफुल, और केवल ड्रॉप्स के साथ हम आपका विजन बचा सकते हैं. ओके, इट्स जस्ट अ फ्यू ड्रॉप्स. नाउ इफ आई वर टू एक्सप्लेन टू यू कि ग्लोकोमा अगर है तो आपको कैसे दिखेगा. अगर नॉर्मली आपको ऊपर वाली फोटो जैसा दिख रहा है, यू कैन सी द एंटायर ब्यूटिफुल सीनरी, राइट? व्हेन यू हैव ग्लोकोमा यू विल सी समथिंग लाइक द वन इन द नीचे का पिक्चर. अगर आप बेड के सामने देख रहे हैं तो आपको इस तरफ का भी दिखता है, उस तरफ का भी दिखता है. बट इफ यू हैव ग्लोकोमा, योर पेरिफेरल विजन, आपके साइड का, बाजू का विजन जो है वो कम हो जाता है, और इतना जहां दिख रहा है उसकी जगह वो कम 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 होके इस तरह से टनल विजन बन जाता है, सिर्फ सामने का दिखना. ओके, डोंट वरी दो, बिकॉज ग्लोकोमा इज यूजुअली अ स्लोली प्रोग्रेसिव डिसीज. All that we need to do is catch it and treat it in time, and you will not face this kind of tunnel vision issue, right? So just remember, whenever you go to your doctor for an eye checkup, ask them, have you checked my eye pressure? Is it okay? Yeah, and they will check and they will tell you, right? So again, just an example of how glaucoma progresses. Picture at the bottom is normal vision. Early glaucoma only sideways, advanced glaucoma a little more, and extreme glaucoma, very severe glaucoma, just the front is seen, right? And this is why I had asked you कि कभी ड्राइव कर रहे हैं तो ऐसा तो नहीं होता है कि साइड का कार दिखाई नहीं दिया, right? Or do you just suddenly stumble against some objects, or you can't see some parts in your vision? If something like this is happening, it means you need to be alarmed and you need to ask your doctor what's happening to you. Okay, so precautions for glaucoma. If anyone here has glaucoma, they are already visiting their doctor and they have their instructions. But if you ever get diagnosed with glaucoma, your intraocular pressure or aankh ka pressure or IOP, this is something that needs to be checked at every visit. And we do this checkup for every patient who comes to me, will get their eye pressure checked, because I want to be able to catch your glaucoma in time, if at all. The next thing, if you feel that you're having accidents or you're bumping into objects, you need to get yourself checked. अगर कभी आपको ग्लोकोमा डायग्नोज हो जाता है तो आपको कुछ ड्रॉप्स दिए जाएंगे। इन ड्रॉप्स का टाइमिंग बताया जाएगा। ये ड्रॉप्स रेगुलरली विदाउट स्टॉपिंग करेक्ट टाइम पे लेना बहुत जरूरी है। और अगर आपके रिलेटिव्स में किसी को ग्लोकोमा है, स्पेशली आपके पेरेंट्स या भाई बहन, तो आप जरूर चेकअप करवाइए क्योंकि आपको भी हो सकता है। The next disease, okay? The next thing is diabetic or hypertensive retinopathy. So retinopathy, again, like I showed you, this is your retina. And now we know what the optic nerve looks like. This is the rest of your retina. In normal people, you will not see these red spots or these yellow spots. It will be a clean orangish yellow kind of a retina, okay? And when these kind of spots start to appear, it means कि आपकी जो छोटी छोटी blood vessels हैं जो आपकी आंखों के अंदर है, this happens also in people who have sometimes you have kidney problems, sometimes you have nerve problems. All these things can happen because of diabetes. And all these spots that you can see are signs that your blood vessels are suffering because of diabetes or because of BP, right? And when something like this happens, you need to get treated as soon as possible to avoid any further damage. Sometimes we can give you drops. Sometimes we may ask you to take a few injections. Sometimes, very rarely, you may require a surgery. Sometimes you may need a laser. But again, if we catch it in time, then there's a lot that can be done to prevent extensive damage. Okay? इसके लिए आपको क्या प्रिकॉशंस लेने हैं? अगर आपको बीपी या डायबिटीज है, आपको हर साल एक बार कम से कम आपके आंख के डॉक्टर के पास, आपके ऑप्थेल्मोलॉजिस्ट के पास जाके आपका रेटिना चेकअप कराना है। रेटिना चेकअप हम कैसे करेंगे? एक ड्रॉप यूजुअली डाला जाता है जिसके बाद आपको 4 से 6 घंटे धुंधला दिखता है। ओके, सो दिस इज अ ड्रॉप दैट वी यूज टू डायलेट योर pupil to see your full retina. You must ask your doctor कि doctor, have you checked my retina, or I would like to get my retina evaluation done. If we do that, we will be able to tell you if there is any change in your eye, and we'll be able to catch it early. Never stop your medication, that is specifically your diabetes and hypertension medication, unless you have been told by your physician to stop. Okay? And always have a regular checkup with your physician. Your BP and sugar must always remain in control. Right. Now that we've covered so many diseases, a lot of patients sometimes are using eye drops that they buy from the chemist. Sometimes you just go to a chemist for something or to a pharmacy, और वहां जाके याद आता है कि अरे मुझे आंख में थोड़ा सा कल इचिंग हो रहा था, कभी लगता है कि आंख थोड़ी सी रेड हो गई है, इसके लिए डॉक्टर के पास क्यों जाना है? यहीं पे sometimes there is a known chemist who delivers drops to your place, who delivers medicines to your place. And we tend to ask them because we have some faith in them. However, there are many types of eye drops. Not every eye drop is for every person. Sometimes drops that are used to reduce redness specifically can contain steroids. They can be harmful to you, and they should not be used in the long run. Sometimes even simple drops like artificial tears, even they sometimes contain preservatives. They have different kinds of compounds. It's not like all artificial drops are made of the same thing. Actually, I've put up a photo, and if you see, many of those eye drops in the first this thing are artificial tear drops alone. But there are so many of them. How can you decide which one is right for you? And this is where your doctor plays a role. Okay, so we can ask you, how many times can you comfortably put a drop? Can you put it yourself? Does someone put it for you? Do you have any allergies? Or if I give you a drop, or if you started using a drop and that's bothering you, can we modify it, change it in some other way, right? So all these things, there are many eye drops in the market. Please don't ask a chemist. Always consult a doctor. They'll help you out with what drops to use, and then we can, do something about it. Always remember, the treatment comes after the diagnosis. So if you have dry eye and I give you drops, that's different. But if you're just using eye drops and then coming back with something, there are people who come back with allergies to eye drops. So don't use an eye drop unnecessarily. To just have a small recap, what should any senior citizen remember to care for their eyes? First, always do one checkup a year. Whenever you go for your checkup, remember to check your IOP, or that is the eye pressure or the intraocular pressure, and make sure that you ask them to check your retina. Okay, IOP and retina. Next thing, when you're on the computer, always follow the 20-20-20 rule. In short, 20 minutes for 20 seconds, 20 feet away, right? The next thing, when you go to your eye doctor, tell them about whatever systemic illness you have, especially diabetes and blood pressure, but anything else also. Say you have ever had an accident or injury, or you've injured, you've had some other problems. Maybe you've been treated for some kind of tumors or cancers, anything of this sort, please inform them. They'll be able to help you and look for specific signs for those things. The next thing, always eat healthy, a combination of nuts, fresh fruits and vegetables, green vegetables, okay, which are kind of rich in antioxidants. Those help you in the long run. Antioxidants are very important for anti aging problems. The last thing is don't use drops unnecessarily. Always ask your doctor who will help you out. Right? This was a short recap. And with that, I think we can open up to questions and answers if you have any, and I'll help you out. Over to you, Mrudula, I think.
Anybody who has questions, who wants to ask any questions to Dr. Neha now can ask. Or you can put them in a chat box and she can read them.
Yeah, you can put them in the chat box also. You can take them at
I have a question.
Yes, sir. Yes.
Whenever that we go in for after the eye checkup, when the doctor prescribes the type of the eyeglass,
Okay.
why these fellows are selling for the progressive glasses? Why they are recommending to go only for the progressive glasses? And that too, in the progressive glasses, they make some three type of here progressive glasses, and they want us to choose. Is it as the correct that all fellows have to go in for the progressive glasses, or is it those who can afford only should go in for that? What is exactly that medically that what the patient has to do?
Correct. Okay. So for those of you who don't know, जिनको पता नहीं है, प्रोग्रेसिव ग्लास एक ऐसे टाइप का ग्लास होता है जिसमें आपको डिस्टेंस, इंटरमीडिएट एंड नियर विजन मिलता है. You get all three kinds of vision, but there's no line in between. So if we have seen bifocal glasses, which is what a lot of people use, especially maybe if your parents are around or they had used glasses, all of them used to use bifocals. You could see that curve at the bottom or a line in the center. What this glass does is that upar ka part is for distance, niche ka part is for reading. Okay, but there's a line in between. So what it does is that you don't get intermediate vision, very clear intermediate vision, and this is especially required for those of us who use computers and things for, sometimes cooking. All these things come at a distance which is neither near nor far, and this is where your progressive glass helps you. It helps you because it gives you a seamless transition between the distance and the near. Okay, which is, and many people do prefer it these days. So for most of us who use computers, progressive glasses are usually ideal, and that's why they generally recommend it. All kinds of variations in it may not be needed. So if it comes to that, then you can ask somebody as to what would be the best for you, and then you can take a call. But yeah, progressive glasses usually most people need these days because bifocal doesn't work as well.
Thank you.
Hi Neha.
Hello.
Yeah. How safe is it if I order my glasses online? I mean, say Lenskart. It's easy for me. It's convenient. Say I wear lenses and I use glasses, and it's very easy for me to order my glasses online and my contact lenses online. So how safe is it without? I mean, I just have to upload my prescription and I have my lenses, and I can choose the tints or the blue film or whatever I need and the type of glass. So how safe is it? Do you recommend me ordering my glasses online, or always go get a checkup and then order my glasses?
Okay, so I'll address this question in two parts. The first one being, is your power correct? Okay. Even if you want to order your glasses online, it's very important that your glass power has been checked thoroughly by a doctor and you have the right glass power. Because once you have the power and it's correct, and then you order it, if they make the glasses correctly, you're going to get the right kind of power and the right kind of glass. The second thing is, when you buy glasses, each one of us has a different frame of the face. Okay, so some of us have a wider face, some of us have a narrower face. Depending on how our face is, our eyes are also placed differently. When we order glasses, one important factor is something called interpupillary distance. Now, this interpupillary distance is basically roughly a distance between the two pupils in your eye. Okay, so if I were to take somewhat the center of the eye, the small aperture or hole through which the light passes into my eye, that distance is very important because that is what you're actually going to look through. So the center of your frame for your glass has to fall on that pupil, right? So even if you want to order glasses online, make sure that your doctor or your optometrist has helped you with your IPD or interpupillary distance, okay? And your glass power. These two things need to be checked by your doctor. Only then should you order your glasses online. And once the glasses come, I recommend that you go back to your doctor and get them checked and make sure that the prescription, the glass made, is according to the prescription and it's not gone wrong somewhere. Because if you go to a chashme ka dukan, at least you will, again, you can ask them that I want to see if I can read properly with it. But if they come online, you have no way to know. So instead of having strain later, it's best if you go to your doctor and get it checked.
Okay. And what about the contact lenses? Are there any fakes that are that you get online, or they're all?
We live in a place where you can get takes for anything.
Right.
This is definitely because it's something that you put on your eye. Okay, they
Right.
actually touch your eye, and if they are the wrong kind of lenses or if the fit is bad, which is even more concerning for hard lenses or semi-soft lenses. If the fit is bad, then they can cause a lot of irritation to your eye. They can cause abrasions and all these things. So contact lenses, I would definitely recommend go to a contact lens clinic and buy. Unless you're a seasoned contact lens wearer, seasoned get the lens and you have found a very reliable dealer, like you're probably going to order from the company itself or something, then it's okay. But other than that, I think you should definitely have contact lenses. You should go to a doctor and check. They can also help you with fitting. Usually we do that also for patients.
Thank you.
Yes. Welcome.
Dr. Neha, after when the cataract surgery is being done, the doctors that they ask the patient what type of a lens that you prefer.
Correct.
One is called local, other one is some what you can call foreign. In foreign may some three types of the lenses. Why are
Correct.
they confusing the patients like that? Why not they prescribe that this is the best lens, you should go in for that?
Okay. Excellent question. And a question that a lot of patients will have very naturally, because we obviously, when we go to someone, we think that they should know the best, and how am I supposed to know, because I'm not in this field, right? One reason, uncle, that um, we have different kinds of lenses and we have to ask the patient is because lenses each have a different budget. Like you said, what is a local lens and an imported lens? So an imported lens usually costs significantly more, but sometimes we will recommend it because it is a better quality, not just in terms of vision, but in the way that it behaves during the surgery. Some lenses unfold very easily, very smoothly. They cause very less trauma. Some of them have some specific things, like how they behave after the operation. They remain stable for a much longer time, something like that. But that said, even though a doctor knows these specific qualities in a lens, he or she is bound to ask you for your budget when it comes to the lens. I think one rough plan that you would probably like to have if you go to a doctor, if you have insurance, you may want to know how much your insurance is going to pay for a particular type of lens. Like some central government schemes will only pay maybe 8,000. Some other company may allow you any value for the lens. Some company may have a capping for the entire cataract surgery. Some may have separate for surgery, separate for lens. So one thing is that how much what is your budget for the lens, whether it is coming through insurance or whether it's coming out of your pocket. And then you can maybe ask your surgeon what is the best available within that range, and they usually tell you what can work for you. Another consideration that we need to take when we implant a lens is that does this patient not want to wear glasses? If that is the case, then sometimes we recommend multifocal lenses. We live in a time where everybody wants to be as independent of glasses as possible. So some people like to have multifocal lenses. Some people may have a high cylindrical number. In that case, we may ask you to use a toric lens, which compensates for that cylinder and reduces your glass power. The aim with all lenses is that we try to bring your power to a minimum while keeping you the most comfortable. It is this fine balance that we are trying to achieve in the constraints of our budget. So that is why maybe most doctors give you a big, kind of menu card and asks you to choose. An easy way to go about it is to know whether on what you want, what you expect after surgery, whether it is suitable to you, and what's your budget. I hope that helps.
It helps on that. But also, does at some point of time the lens needs to be replaced? Maybe after 10 years, 15 years, it happens like that.
So there are very, very, very rare circumstances in which a lens may have to be replaced. And it is usually something that's completely sort of unanticipated. A lens that we put in the eye is meant to last for the rest of our lives. We don't really need to change it. That said, it is an artificial implant, and there may be a very rare circumstance in which we may have to do something for it, but it's not something that happens regularly at all, so it's not a consideration. No.
Okay. Thank you.
Dr. Neha, I have one question for you. Like many of the elderly patients who come to me, you must be knowing that falls are pretty common in elderly. So from ophthalmological point of view, what would your suggestions be to the elderly? I mean, to prevent fall. Like one, I can suggest like what you said mentioned is to correct the cataracts, get it treated or surgically removed. So anything else that you can suggest from eye point of view?
To see is whether or not the patient's vision is already affected. So there can be two scenarios in this. One, that the patient is presenting to you with a fall, and from there on we evaluate the patient and realize that maybe they've had a stroke at some point, maybe they have some kind of visual field defects or something of that sort, or that we already know that the patient has these kind of problems, and thereon we try to correct them or to avoid falls. If the patient has presented to us with a fall or has been stumbling very frequently, yes, we need to get their cataracts done, but we also need to make sure that they don't have any other eye disease, which is kind of limiting their field of vision. Um, if that is the case, then they need a full ophthal evaluation. One primary important thing being glaucoma, the other one being again um, something like diabetic retinopathy, which the patient may not know of. It can be a very silent thing. So we need those things kind of corrected. And if the patient already has a visual impairment, then I think the best thing to do would be to understand how severe that impairment is. Accordingly, either we give them some kind of vision aids. If they have some kind of field defect, we give them prisms or something like that, which will correct that visual field defect. make sure that they have something like a walking stick or something of that sort, which helps them to work in the areas in which their vision is affected. Make sure the lighting is correct. Make sure it's easy to get off and on their bed, and those kind of things. Maybe someone to help them out too, a professional maybe. Does that answer it, or was there anything more specific?
One question was raised about multifocal or progressive lenses, I mean spectacles. So I
Right.
was asking, is it advisable for elderly to use multifocal or progressive lenses while they're, I mean, climbing down the stairs or walking on the road on an uneven surface? Suddenly their focus can change. So do you as an ophthalmologist advise bifocal or multifocal or progressive spectacles to these patients, or how does it work?
Yeah, excellent question. So this happens. This happens especially in people who have just started to use progressive lenses. By themselves, progressive lenses are not a problem. And I think if a patient has been using progressive lenses for the past 5 years, 10 years, whatever, even if they are now at an advanced age, they should not have a problem because they have adapted to the idea of where they are looking. But if they are now going to change their glasses from a bifocal to a progressive, I would not advise it. I would say that if you're used to something, stick to it, because it's not going to cause that much of a problem, especially when walking down the stairs or walking on footpaths and then getting down. Yes, the focus can change. It's important to remember that they're supposed to look from the top part of the lens for these things. So they may need to adjust their glasses accordingly. Usually, in a well-made glass, it's not needed, but yeah, it can happen if it's a new glass. Also, I think they should not change the type of frame that they use. So if you're used to on slightly narrow, say 3-4 centimeter glass, you should probably stick to that height. You should not suddenly make it very narrow or very wide, because that changes the way that the glass is made, and that's when accidents happen more.
Okay, thanks. I think there is one question asked by Pavin D. Like, please advise whether we go for glass lens or plastic lens.
Both are okay. Glass lenses tend to be a little heavier, so a lot of people don't prefer them. The plastic lenses, which are made of basically some kind of acrylic materials, they are also pretty good in terms of vision. Both work completely okay. If you have scratches on either of them, they need to be replaced. Lighter and more weight friendly, I think, are the non-glass ones, fiber.
Anybody else have any questions?
So from a geriatric point of view, what I would like to tell is like what Neha told, to maintain your overall health, you have to get your cataract corrected as early as possible. And the other important thing, what she mentioned about diabetic retinopathy and hypertensive retinopathy. So these are chronic non-communicable diseases. So you have to have a check. I mean, on these both these medical conditions, like a sugar should be well controlled with lifestyle changes, the diet, and the exercises, that as well as the medicines that your doctor is prescribing. And with this, it is possible to prevent many of the comorbidities and complications arising out of this. And other than that, I think we have covered extensively. Uh, I think that Mr. Pavin D has again put, but fiber change color something in for the
Right.
question.
So I think so. Your fiber glasses, whatever they are, even if that happens, it happens over a very long period of time. By which time I think it's anyway advisable for you to change your glasses. Another thing is, if you mean that the glass change happens from when you're going from outdoors to indoors and they change tint, that is because you've probably opted for that type of glass, and that is causing the problem. Those are called day and night glasses usually by the optometrist. So you may have a glass like that. But if you're talking about changing color over a long period of time, I don't think that's something to be very concerned about. a good quality one will not change color that much.
All right. Along with many, many insightful questions, Dr. Neha, you have also got an amazing feedback in chat box, and
Thank
I'm
you.
sure you have been going through all of them.
Yeah, thank you.
Right. On behalf of Jyeshtha Care, even I am glad and really thank you very much for giving very, very informative questions.
Thank you.
Before I go ahead to introduce Jyeshtha Care, Mr. Harpal Singh, do you have any questions? You have raised your hand.
Yeah, yeah.
Yeah, yeah, you can go ahead.
I am suffering from ARM and hello, hello, can you hear me?
Yes, but you will need to be a
Hello.
little louder, sir. Can you be a little louder?
I am suffering from ARM for last many years, and my vision is getting less and less over the years.
Okay.
So, is it reversible or it is irreversible?
Okay. Yes, so sir has spoken about ARMD. For the benefit of everyone else, ARMD stands for age-related macular degeneration. Okay. Age-related macular degeneration is a very vast topic, which is why I didn't cover it in my this thing. But since you've asked the question, sir, um, there are different types of ARMD. It can either be a dry or wet type. Okay. If it is a dry type, usually it's something that progresses slowly over time, and there's not a lot that we can do about it, except for maybe giving you a lot of antioxidants which will help. The wet type of ARMD kind of gets better, gets worse, and then can sometimes get better with some injections. If there are any bleeds or anything like that in your retina, we can try to control them. And that is the one that requires much more regular treatment. So just off the bat, without knowing your history and without actually having seen you, it's very difficult for me to say how your disease will progress. But what you need to do is be in constant contact with your retina specialist if you're going to one, or at least whoever your ophthalmologist is, and they will guide you accordingly. Yeah, we need to see all our patients for ARMD. We see them anyway when we do a regular retina evaluation. And if we feel that you are suffering from ARMD of any kind, we generally prescribe some antioxidants to you. And if it is a wet type of ARMD, then the treatment will be depending on the way you have presented to us. So if you presented with an active lesion in your retina, if there's something actually actively going on at that time, or whether it is more of a preventive and precautionary measure. So ARMD, you need to visit your doctor, and only then I can give you more info. Thank you so much.
Okay, thank you.
Thank you.
Right. So let me take if nobody has any further questions, I like to take this time to talk a little bit about Jyeshtha Care. So Jyeshtha Care is Mumbai's first home care service led by a specialist geriatrician. We cater exclusively towards the healthcare needs of the senior citizens and aim to provide them with the best quality care in the comfort of their own home. Some of our services include home doctor visits, nursing care by certified nurses, trained attendees to assist the elders in their daily activities, home physiotherapy sessions by our expert physiotherapists, geriatric assessment and counseling by our experienced psychologists, nutrition advice by our dietitian, selling and renting of medical equipment like hospital beds, oxygen concentrators, etc., and lab tests in the convenience of your home. All of this is under the supervision and guidance of a team of senior and experienced doctors. I thank you all of you for joining us today. If you want to contact Dr. Neha in any time further, you can always reach out to us. You have our contact numbers, and we will be able to, we'll be glad to direct you to her. And with this, we can call it an evening. Thank you very much, Neha, once again for giving your wonderful and precious time to all our participants.
Thank you so much. And I'd like to thank Jyeshtha Care so much for inviting me. They're doing a great job. And I can see that a lot of people that I know and I invited for this talk personally have turned up. So, again, thank you from the bottom of my heart that you attended the session. I hope it was useful for you and that you know a little bit about Jyeshtha Care. And yeah, I hope to see you all whenever you need me.
Right. Thank you very much. Thank you very much, all of you, for cheering us up and making it more interesting for all of you.